Medicare decisions can be overwhelming. Deadlines, gaps, endless options. It's enough to make your head spin. But don't worry. Adam Lubenow is a Medicare specialist with senior advisors, and he's built his career on making complex topics like Medicare simple. Before joining the family business, Adam worked with top companies including Verizon, Salesforce, and Microsoft. Now he's helping people like you navigate Medicare, when to enroll, and how to choose the best coverage for your needs. Adam's going to cut through the noise and give you the answers you actually need. We'll cover when and how to enroll and, most importantly, how to choose the right plan for your unique needs. And when you're ready, check out Quote.com to easily compare Medicare plans and find the best coverage at the best price, without the headache. Now let's dive in, because the right Medicare decision could save you thousands. Let's get straight to it. How do you know if it's time to sign up for Medicare? Adam breaks it down for you. Should I enroll in Medicare?
If you're approaching 65 and still working, and with an employer that has less than 20 employees, you should be enrolling in Medicare. If you have group coverage with this employer, the group coverage will become the secondary payer once you turn 65, which means they will only pay 20% of your bills. So if you did not enroll in Medicare in this scenario, you would be responsible for 80% of your bills that came from doctors. By enrolling in Medicare, Medicare Part B will pay 80% of your provider's bills, and you would evaluate your options, typically choose a Medicare Supplement or a Medicare Advantage plan as an alternative to your existing group coverage.
To make sure you're getting the best coverage possible and compare all of your Medicare options side by side, visit Quote.com today. There you can use our free quote tool to get personalized results in minutes. Don't leave your healthcare to chance. Check out Quote.com today. But if you're still unsure about what to do, let's clear up another important question. What's better, Medicare or group coverage?
If you are employed or your spouse is employed with a employer that has 20 or more employees and you have their group coverage, you can evaluate Medicare as an option. You can evaluate Medicare to see how the coverage would compare to what you have with your group employer and what the cost would be that's associated with that coverage. More often than not, it's better to stay on your group coverage in that scenario, but you never know, and it's absolutely worth evaluating it to ensure that you're making an informed decision going forward about whether to enroll or not enroll.
Remember, making sense of Medicare doesn't have to be overwhelming. At Quote.com, we make it simple with our free quote tool that lets you compare Medicare plans side by side. Whether you're transitioning from employer coverage or enrolling in Medicare for the first time, you deserve a plan that meets your needs and budget. Take control of your Medicare choices with confidence with Quote.com. And to help you feel more secure in your decision, let's walk through the steps of enrolling in Medicare. How do I enroll in Medicare?
We no longer recommend that people go to the Social Security office because it requires an appointment to speak with someone at the Social Security office. And in order to make the appointment, you have to wait on the phone for about 2 hours.
So now we know you shouldn't start the process at the Social Security office. But what is the best plan for enrollment? Can I enroll online?
The online enrollment works very well, and you can go online to enroll in Parts A and B, and it's very simple if you're turning 65. If you're over 65 and you're now retiring and enrolling in Parts A and B, or just Part B, again, you'll do this online. There will be an extra step required in this scenario, and that is uploading an employment verification form. When you enroll in this scenario, when you're retiring and after 65, you'll have your employer fill out a form which validates the fact that you've had group coverage and been employed, you or your spouse, throughout the time that you turn 65 and when you're enrolling in Medicare.
Now, to make sure you're navigating these steps with ease and to compare your Medicare plan options, go to Quote.com. Whether you're enrolling for the first time or making changes after retirement, you don't go in blind when you compare your options at Quote.com. Now, to make sure you're not left with any gaps in knowledge, let's hear Adam. What does Medicare Part A cover?
Medicare Part A is hospital coverage. Most people do not pay a premium for Part A because they've been paying taxes toward this throughout their career. As long as you've been employed for 10 years or more, You do not need to pay a premium for Part A, and Part A is hospital coverage. Part A has a deductible, and the deductible changes each year and is based on a 60-day period. If you've paid your deductible and you're staying in the hospital and you leave the hospital and you come back within 60 days, you would not be responsible for paying the deductible again. However, if 60 days has lapsed and you're going back to the hospital, you would be responsible for the deductible once again.
Navigating these complexities doesn't have to be a solo journey. Visit Quote.com today to learn more and compare options instantly. Our free quote tool streamlines the process of exploring various Medicare options, ensuring you understand exactly how deductibles and coverage periods impact your potential costs. And Medicare Part A is just one aspect of your coverage options. Now, let's explore what Medicare Part B has to offer. What does Medicare Part B cover?
Part B is provider care. This is the coverage that helps you with your doctors and specialists. Part B pays 80% of your doctor bills. You'll need something else to help with the remaining 20%, and we'll talk about that later. The premium for Part B varies based on your income level, and it will change every year. Also, the premium is based on your adjusted gross income from 2 years prior. So if you're enrolling in Medicare in 2025, your Part B premium will be based on your income from 2023. You can appeal this if you would like because of a life-changing event. The most common scenarios to appeal a premium is retirement or work reduction.
Keep in mind that Medicare decisions are critical, and choosing the right coverage can save you a lot of money. So don't navigate Medicare alone and head over to Quote.com today. Make sure you're securing the best coverage at the most competitive price, because the right Medicare plan is out there, and we're here to guide you every step of the way to find it. But wait, there's even more to Medicare parts that you need to understand. What does Medicare Part C cover?
Part C is analogous with an Advantage plan. Part C actually takes over from Medicare. If you do enroll with Part C or an Advantage plan, you are no longer on Medicare and you're with a private carrier's insurance. The private carrier takes over for the government, so you're truly not on Medicare anymore, and we'll talk about the differences between Advantage plans and original Medicare. Advantage plans, or Part C, typically bundle in multiple things such as Part D, which we'll discuss next. Dental, vision, and hearing and gym memberships are also very common with Advantage plans or Part C. The premium for an Advantage plan, while you'll still pay your Part B premium, varies and can very often be zero. So it needs to be determined based on where you live and the coverage options you're looking for.
To figure out the best Part C plan for you and to compare all your Medicare options in one convenient place, head to Quote.com today. At Quote.com, we make comparing plans easy with our free quote tool, helping you find the best coverage at the best price in just a few clicks. Now, you might think we're done after Part C, but hold on. We've still got Part D to dive into. What does Medicare Part D cover?
Part D is for your medications, Part D for drugs. Part D plan needs to be evaluated every year to determine what the best drug plan is for you. The best drug plan is very specific to each individual based on their medications. There isn't any other way to go about it. One plan is not fundamentally better than another, but absolutely one plan is better than another for you based on your medications and how they align with the various plan formularies. And Part D premiums can vary. They can vary greatly. Some plans are $0 and some plans are $100. And again, the $100 plan is not necessarily better than the $0 plan.
At Quote.com, we make comparing Part D plans easy with our free quote generator, helping you find the right coverage at the right price. Don't let the complexity of Medicare overwhelm you. Take control of your healthcare decisions and find the perfect plan for your needs at Quote.com. But if that didn't already seem like a lot to navigate, there's still one major decision you need to make: Original Medicare versus Medicare Advantage. These two options work very differently, and understanding the key differences is crucial to choosing the right coverage for your needs. So, how do they compare? Adam breaks it down for you. What does Original Medicare mean?
Original Medicare means that you are staying with the government for your Medicare coverage. You will have Medicare Part A, Medicare Part B, and because Part B only pays 80% of your premium, you will purchase a Medicare supplement. The most popular supplements are Plan G and Plan N. You'll purchase a Medicare supplement to help with that 20% that Part B does not pay. And the Medicare supplement will also cover your Part A deductible and various other fees that may be associated with Part A. You will also purchase a drug plan, a Part D plan if you stay with Original Medicare, and the drug plan should be evaluated each year.
Feeling confused? We're eager to help. Just visit quote.com. We offer a personalized quote that lays out all your options in a clear, concise way. Remember, the flexibility of choosing your own providers is a major advantage, but your doctors play a major part in that. Ensuring that your doctors accept your plan is critical. Let's dive into why doctor participation plays a key role in your healthcare experience. What are the benefits of Original Medicare?
Original Medicare is a wonderful thing because 98% of doctors participate with Original Medicare and 99% of hospitals participate with Original Medicare. This means that there's a lot of flexibility to seeing the providers that you would like to see. And if a provider recommends a procedure that's approved by Medicare, you will get the procedure without any fighting on your behalf. There is no prior authorization required. A lot of flexibility with the providers that you could see, a lot of lack of stress associated with being approved for procedures with Original Medicare. And also your costs are typically very fixed because you'll be paying a premium for your supplement each month. And outside of that, you're typically not going to have any bills.
To get a handle on all your Medicare options, visit quote.com today. Your healthcare deserves more than a one-size-fits-all approach, so take a few minutes today to compare your options using our free quote generator. Now you're probably thinking, what about dental, vision, and hearing? Are those covered by Medicare? Here's the answer. Are dental, vision, and hearing covered by Medicare?
Dental, vision, and hearing is not included with Medicare. If you would like dental, vision, and hearing coverage, then you can purchase that as well to provide insurance cost sharing for those services. That needs to be evaluated on an individual basis to determine whether or not you see value in those services.
And when you're looking for the best plan at the best price, all you need to do is to make a beeline to quote.com and easily compare your options. Don't leave your health to chance, including what Medicare doesn't cover. Get the protection that fits your lifestyle with quote.com. But it's easy to get mixed up here. For example, you may be asking, is a Medicare Advantage plan part of Original Medicare?
If you choose a Medicare Advantage plan, you are no longer with Medicare, you're with a private carrier, which means that the doctors that you see need to participate in that carrier's network. You typically wouldn't be paying a monthly premium for your coverage outside of the Part B premium. And again, you're not on Medicare, you're with a private carrier. So doctors need to participate. Prior authorizations are now required. If a doctor recommends a procedure, we need the carrier to approve that procedure. And because you're paying such a low premium each month for the coverage, now there'll be cost sharing when you do receive services. You'll be paying a bill each time you receive services until you hit the max out of pocket for the Advantage plan that you have.
To make this crucial decision with confidence, visit quote.com. Make sure you're making the right choice for your needs. Compare plans and get expert guidance today at quote.com. But how can you ensure that your application for a Medicare supplement plan gets approved? How does a Medicare Advantage plan work?
In order to get a Medicare supplement, you would need to be approved through underwriting if it's beyond 6 months of your Part B start date. This means that when you begin Medicare Part B, you cannot be turned down for a Medicare supplement. You have ironclad insurance and you can't be turned down for the insurance. The Medicare supplement can never be taken away from you, and the Medicare coverage will never change. It's federally regulated. If you choose the Advantage plan path, and years later decide that you would like the supplement, you could be declined and locked out of Original Medicare for the rest of your life. So this is a very important topic and very important decision.
But don't navigate these complexities alone. Quote.com is here to help. Our free quote tool simplifies the process by allowing you to compare Medicare options side by side from multiple providers. This empowers you to make a fully informed choice, understanding the long-term implications of your decision. But what if you're not happy with your current Medicare Advantage plan? What are your options for making a change? How often do Medicare Advantage plans change?
They can change every single year, so it's important to evaluate your options each year to ensure that your providers are still in network and that you're choosing the best plan for you going forward for the following year.
When can I make changes to my Medicare Advantage plan?
You can change your Advantage plan between October 15th and December 7th each year for the following year. And you can also change your Advantage plan between January and the end of March for the following month. If you enroll in a different Advantage plan in January, that means your new Advantage plan would begin in February.
Now, these timelines and understanding the implications of your choices can be overwhelming. But don't stress. Quote.com is here to simplify the process. Instead of trying to keep track of these dates and regulations yourself, imagine having all your Medicare options laid out clearly, side by side. Our free quote tool lets you compare Medicare options from multiple providers, all in one place. There, you can easily see how plans change year to year and find the best fit for your needs. Now let's talk about something just as essential. How do Medicare supplement plans fit into your coverage? How do Medicare supplements work?
Medicare supplements are federally regulated. This means that coverage is identical among all carriers. While pricing is not identical and underwriting requirements are not, the coverage is identical. Some carriers may include some add-ons like gym memberships, but these gym memberships are not guaranteed to be attached to the supplement throughout the remainder of your policy. So the Medicare supplement will remain intact and never change. This is federally regulated, where the gym membership can potentially be removed because there's no federal regulation associated with an add-on like a gym membership.
Now, instead of trying to figure out which carrier offers the best price and perks and which one has the most stable add-ons, picture having a clear side-by-side comparison of all your options. That's what Quote.com offers. Don't waste time and risk choosing a plan with unstable extras. Visit Quote.com today and simplify your Medicare supplement shopping. But we're not through just yet. Choosing a Part D plan is a critical decision, so Adam is here to answer how you choose the Part D plan that suits your needs best. How do I choose a Part D plan?
Identifying the best Part D plan is very important, or else you can be overpaying for your medications in big ways. So in order to identify the best Medicare plan, you go to Medicare.gov and go to the Find Plans section. You'll enter your zip code and you'll select that you want to evaluate Part D plans. You will enter each of your medications, the dosage for each medication, and the quantity that you take per month or for 90 days. And this tool will help you understand the most economical Part D plan for you going forward. You can only change your Part D plan each year between October 15th and December 7th, and that will be for the following year.
Selecting a Medicare plan isn't something to take lightly. Explore all your options at Quote.com to make the best choice. Okay, so what you want to do with this evaluation is be less concerned with the price per month of the Part D plan and be more concerned with the total cost of ownership of the plan and your medications. The tool will prioritize this. It will bring to the top of the list the plan that will offer your medications and the plan itself combined at the lowest cost. So this way, you can ensure that you're paying as little as possible for the plan and your medications. This is a critical exercise because if you don't do this, you may end up in a plan that you're overpaying for or medications that you're overpaying for. This can have real dramatic impact, especially if your medications aren't covered by the plan that you're enrolled in. And that concludes our Q&A with Medicare specialist Adam Lubenow. Today, Adam helped break down the ins and outs of Medicare, when and how to enroll, the differences between original Medicare and Medicare Advantage, and how to choose the best coverage for your unique needs. Remember, choosing the right Medicare plan is a big deal, and being prepared with the right information will save you from unexpected costs and headaches down the road. If you're still weighing your options, make sure to take advantage of Quote.com. You can quickly compare rates, explore different plans, and get personalized quotes from top insurance providers all in one place. Finding the best coverage doesn't have to be overwhelming, and Quote.com makes it easy. If you found this video helpful, hit that like button. It helps us reach more people who, just like you, are trying to navigate Medicare and find the best plan. And if you want to stay ahead of the game when it comes to Medicare, as well as home insurance, auto coverage, and more, subscribe to our channel. We're here to bring you clear, no-nonsense information that actually helps you make smart insurance decisions. Got questions? Drop them in the comments. Whether you need more details on Medicare, have something specific to ask Adam, or just want some guidance on picking a plan, we're here to help. And if you've already chosen your Medicare plan, share your experience below. Your insights could make a huge difference for someone else going through the same process. Do you know someone who's shopping for Medicare? Make sure to also share this video with them. Whether they're just starting their search or trying to make sense of their options, this could save them a ton of time and stress. And before you go, we've got another video you need to check out. If you're looking to cut down on costs, don't miss our breakdown of the top home insurance providers that could save you up to 30% this year. And here's why this matters. Even if you're focused on Medicare, saving on home insurance means extra money in your pocket for better healthcare coverage. It's all connected and every dollar counts. Thanks for watching, and we'll see you at the next video.